Hi there, good morning. This is Dr. Daniel Tan here over at the Dental Implant Center, and today we're going to talk about something a little bit different. We're going to talk about what happens when you have had implants placed and the implants aren't placed in the most ideal position. How do we fix that situation? What do we do then? Is it the end of the world? And that's what today's presentation is going to be about. And how we're going to do that is we're going to run over a case that we treated here in the Dental Implant Center. This patient that you're seeing over here came to us after his implants were placed. Treatment was done at another dental office, and when he came, he actually did not have teeth in his mouth for a few months. So he presented to us looking just like this. That's the upper, and here's the lower right now. You can see that around the existing dental implants, there's a lot of plaque and a lot of tartar buildup, and the overall situation isn't the healthiest. Now, before we begin any actual dental implant treatment, the most important step is to diagnose what's going on, to find out what's happening. And one good way of doing this is to take an X-ray. So this is a panoramic radiograph of the same patient, and here you can see that the implants have been placed in a pretty classic all-on-4 situation where some of the implants, especially on the upper left side, they are placed at a very steep angle. The first thing we do surgically is to open up and see where the implants are. So here's where the photographs are going to get a little bit more bloody and a little bit more surgical in nature. And in this situation, we uncover the implants and take a look at what exactly is going on. In this case, we did find that the implant on the upper left side was far too shallow and far too steeply placed to be useful. And because of that, we weren't able to include this implant in the overall treatment that we were going to produce. 2 additional implants were placed at the back in order to support the final dental prosthesis. This next series of photos shows an evaluation of the angle of the implants. Now from the front, it looks good, but once you turn to the side, you can see how the front implants seem to be sticking a little bit out of the mouth. The same thing is going on in the lower arch, where the implants begin to angle quite far towards the front. This is a good example of how radiographs can sometimes be a little bit misleading. Even though the X-rays look good and the implants look straight on the radiograph, in the mouth it can be a very different situation. After this appointment, we begin to fabricate provisional restorations, or what we call temporary restorations, and this is how the patient leaves. When the patient leaves, these provisionals sit in place and they allow the tissues to heal around the provisionals, and it gives the patient something functional and aesthetic that they can bring back with them. This is at the time of implant placement. You can see that there are 2 new implants at the back, and the implant was cut short and buried underneath the bone so that it is allowed to heal. After 3 months of wearing the provisional, the patient returned to us with the tissues in a fantastic state. In this kind of situation, it goes to show how a well-contoured provisional and good hygiene from the patient is able to produce a very healthy tissue outcome. At this point, we begin to use his provisionals as a prototype, and the lab is able to make a prototype out of wax and acrylic. We try this in the patient's mouth and to see how it looks. At this point, we are really critical about the aesthetics, and we are very picky about the shape, the position of the teeth, and we pick a color with the patient at this stage so that the definitive restorations are exactly how we want them to be. With that information, the lab is now able to fabricate definitive prostheses. These prostheses come together and fit very nicely, and the lab is able to produce quite a lot of character, making sure that the teeth have a lot of definition, have a lot of translucency, and they don't look like individual monochromatic blocks. Specifically for this patient, those of you with pretty sharp eyes will notice that there is a little hole in the side here, and that's because this particular implant was angulated too far out for us to be able to correct the angle, even with some of the special angle correcting screws that we use. So the way we work around this problem is to eventually close up those restorations with the tooth-colored filling material. Now, we also pay a lot of attention on the underside of the prosthesis. This is where it gets really important. This is an area that not a lot of people see ever, and you don't see it when you're opening your mouth as well. But we want to make sure that the contours here are very nice and convex and round so that it's very easily cleaned and something that you can maintain for a long time. At the day of delivery, the patient came to us with really beautiful tissues. You can see that on that side that we buried the implant, the tissues have fully healed over it now. And all these little dimples are little places where the provisional is providing just a little bit of positive pressure so that you don't get food caught up under the prosthesis, and you're able to maintain the health and the aesthetics of it. Finally, we actually seat the prosthesis and screw them in place. We choose screw retention as our main mode of treatment because this allows us to get in and unscrew the prosthesis should it ever need any additional treatment or maintenance work. In addition, it helps to avoid the problems associated with cementing a restoration in place, such as cement flowing around and contaminating the dental implants. As usual, we take x-rays to make sure that everything sits properly, and we want to make sure that the components all fit beautifully on the implants and that there are no problems associated with this kind of treatment. The extra white material that you see on this radiograph here is the zirconium material that we use for bridges. This is the high-strength ceramic that is widely used in implant dentistry nowadays, and it provides for a much stronger outcome for the patient. And the end result is a patient who has a restoration that is both functional, aesthetic, and easy to maintain. The most important part is that at this point we are setting up the patient for long-term success with dental implants. They can last a very long time, but we want to make sure that we contour them well and we give the tissues every chance of success in being able to hold the restorations for the rest of his life. So that was an example of how we managed botched dental implant treatments over here in the Dental Implant Center. Stay tuned because this is not the only case that we work with. A good 20% of our cases involve treating or retreating cases that have been done in other offices. So we will continue to update this gallery and we will continue to update you with different treatments that have been provided over the years.